places that are hard to reach or places that you don't want to apply a cream or an ointment. So those can be quite nice. Sometimes tapes are, steroid in a tape can be used on places that get a lot of trauma or a lot of use. That may be helpful. Again, the feet, a tape may be helpful, or if they have localized areas. There's also medicines that turn over the skin more quickly in peeling off the skin, and some that you leave on for short periods of time to try to decrease the body's ability to turn over. There's also topical vitamin Ds that can be applied to the skin. The vitamin D seems to help minimize the skin turning over. So there's a range of topical things that can be applied to the skin. Unfortunately, it has to be generally on a routine basis in order to maintain whatever improvement a person's gotten.
Mm-hmm.
Sometimes if there's certain localized areas that people have, steroid injections into those areas. Say, for instance, they are using a lot of topical medications and they have a few spots that are just not going away. Putting that medicine underneath the skin can be quite helpful.
Oh, so that benefits.
Also, at Advanced Dermatology Care, we have a type of laser that emits high concentrations of ultraviolet light. And it's different than going to an ultraviolet light booth where your whole body's getting irradiated.
Sure.
And then getting sun damage and hitting places that don't necessarily need it. It's not being focused, it's not being targeted. So this wand has the ultraviolet light coming out, and it can be applied to the areas that are affected.
Sure.
Areas that have really high, difficult areas to treat, such as the palms and soles. That can be a good place. Or again, the scalp, where sometimes getting medications into it can be difficult.
Should just hit right on the source of
Correct.
it. So, you know, when we're talking about this, is there something that maybe someone can stop to do so they don't have any flare-up, you know, in that sense, or what, is there something that might trigger it so to help with the flare or to stop, prevent, you know, the actual occurrence?
That's a good question. Sometimes people don't even know what it causes, and we don't understand why a person can have a flare and what makes it go away. It does have a tendency to cycle, wax and wane, and sometimes you can figure it out. It might be an infection, it might be the stress in their environment. Typically it's not flared by food, those sorts of things, but
would it even be maybe their immune system's down a little bit?
certainly.
Because they're fighting something else off, and then that triggers it too?
Absolutely.
Okay.
Yep. Also, we talked a little bit about the topical and the ways of laser sorts of ways, but there's also been some great advances over the last few years in injected, self-injected medications, and they can range from something that's injected into the person's more fatty areas, their abdomen, their arms, their thighs, anywhere from a couple times a week to most recently in the last month a new medicine came out that can be injected 4 times a year.
Oh.
So it can significantly help their quality of life. There are a little bit more potential side effects when you're putting something into your system like an injectable medication, but it certainly can make the tedious nature of applying medications, especially if it's a large area, a lot more tolerable.
Right. And also they have to judge for themselves whether or not, you know, the benefits outweigh, you know,
Absolutely.
that situation when you do have that. Wow.
And we try to individualize the program, what's worked in the past. How aggressive does a person want to be? How clear do they want their skin? Do they just want the areas that are visible to somebody walking down the street, or do they want to have more of their skin surface area improved?
Right. Yeah, that's good to know. And they can go to you. And you have all these different treatments for them, so that would really benefit. So when we're talking about this, how should I change my skin care regimen then during the winter? You know?
Well, as I mentioned, hydration is a key because in a Minnesota winter, the air dries out and our skin, which our body's mainly water, and we lose some of that humidity in our skin. You need to try to supplement that as best as you can, and certainly having your humidifier running either at where you sleep at night if you don't have one on your furnace, where you spend most of your time if you can have that area well humidified. That can be quite helpful so you're not losing as much water from your body. Also making sure that whenever you take a shower or bath, you're stripping off some of your normal oils, that you reapply some of the oils with a lotion, emollient. That can be quite helpful. Trying to minimize caffeinated products, because caffeinated products encourage elimination of water from the body, and then again you're going to lose more water and dry out more readily. So hydration can be quite an important process that needs to be done in the winter months.
Yeah, and it's hard to drink cold products in the winter months, you know.
Right, and so that's another good point. The opposite of losing is drinking more and trying to make sure you get plenty of water into your system to fill up what's being lost.
Yeah. You know, you hear so much about skin with the sun coming in, you know, you're needing it on your skin, and everyone's, you know, also pushing for vitamin D. So I would think that that would be a really good supplement. What are your thoughts on that?
Certainly, as we talked about, vitamin D as a topical medication is available, can be quite helpful. So supplementing it in your diet can be quite helpful as well. It may not be a major difference, but a lot of times, since a lot of the skin conditions are multifactorial, the more things that you can do to benefit your skin, hopefully the less aggressive you have to be with other modalities, such as the injectable medicines or medicines that you take internally that do affect your whole body.
Right.
So if you can be good about supplements like that and remember to take those on a regular basis, that can be quite helpful.
Right. And I wanted to talk a little bit about treatments that are available. You touched a little bit on some of them, but does that apply, and what else do you have available at your clinic?
At Advanced Dermatology, we can prescribe any of these myriad of topical steroids we talked about, topical vitamin D products, medications that can help peel the top layer skin so the medicines can be more penetrating. There are certainly some medications that can be taken internally by mouth. Unfortunately, some of them have more side effects, so again, you weigh the risk and the benefits. So somebody that has diffuse problems are going to probably want to use something like that. Get their skin condition under better control in combination with the topical medicines, and as they improve, try to get off those systemic medications and maybe even on a lower dose. And then certainly the medicines we talked about, the new injectable medicines, in some cases have less potential risks and side effects, a little bit more specific to what we believe is going on in psoriasis, the rapid turnover of the skin, it's not maturing as it's supposed to. Those can be quite helpful. And then the laser treatment can be quite helpful, again, if you have certain stubborn areas that are difficult to get rid of.
Okay, when did the laser treatment actually come out, you know, to help your patients with psoriasis?
Ultraviolet light has been used for many years, and then being able to put it into a fiber optic. We've had it at our clinic over the last about 5 years.
Okay. So you actually take a person in, you individualize them, you talk about them, you tell them about the potentials of other treatments, and then let them decide, take that information home. You educate them, give them some information, and then they make the decision for themselves.
And we try to guide them along the way with, I think, again, education is very important, because some of these medications can have rather dramatic side effects. And a lot of times people will see something on TV, or particularly maybe an ad, and it may, in a very short amount of time, list the side effects, and they may not catch them all.
Right.
They may be focusing, oh yes, my skin's going to get a lot better, without paying attention to what really can happen. And some people are willing to take that risk because it is debilitating, either functionally or socially. And if that's the case, great, we can try to help them use it safely.
But they have to look at everything that's available and then make the decision for themselves. And
Correct.
then, you know, you will make it available to know, well, okay, this will happen. And, you know, sometimes it doesn't happen to them with the side effects. It doesn't affect everyone.
Correct.
You know, so maybe they might be the lucky one.
Right.
You know, and that available.